We're going to talk about something that could genuinely help you save a life, maybe even your own. A heart attack isn't always loud and dramatic. It can be quiet, confusing, and easy to miss. But knowing the signs, both the obvious ones and the really subtle ones, and knowing exactly what to do, that can change everything. Okay, let's dive right in.
So when you picture a heart attack, what comes to mind? For most of us, it's that classic movie scene, right? Someone grabs their chest, looks shocked, and just collapses. And yeah, it can happen like that, but honestly, the reality is often way quieter, much more confusing, and unfortunately, a lot easier to just brush off. So let's get on the same page about what a heart attack actually is. Think of it like a plumbing problem in your body's most important engine. The blood flow that carries precious oxygen to your heart muscle gets blocked, usually by a clot. And when that muscle doesn't get oxygen, it starts to die. That's why every single second counts. All right, let's start with the symptoms most of us are familiar with. These are the ones you see in health class posters, the classic textbook signs that scream heart attack. Here they are. That number one sign is the chest pain, and we're not talking about a little twinge. It's often described as a crushing pressure, like an elephant is sitting on your chest. That pain can also travel or radiate, most famously down the left arm, but it can also show up in the neck or jaw. And it's usually paired with a sudden shortness of breath and breaking out in a cold sweat. If you see this, you know it's a serious emergency. But, and this is so important, a huge number of heart attacks don't follow that classic script at all. That's why this next part is maybe the most critical thing we'll talk about. These other symptoms can be subtle, they can be vague, and they are so easy to mistake for something else.
Just look at the contrast here. On the left, you've got the big dramatic signs that are hard to ignore. But now look at the right. Extreme fatigue, nausea, an ache in your back or jaw. I mean, come on, who hasn't felt these things and blamed them on a bad night's sleep or something they ate? This is why these signs are so dangerous, because we're conditioned to ignore them.
And this quote right here, it just hits the nail on the head. We know from research that women, especially, are more likely to get these non-classic symptoms. The signs can be insidious, which is a great word for it. They're sneaky. They creep up on you. So you might not realize you're in the middle of a life-threatening emergency until valuable time has been lost. Let's really look at these. We're talking about a sudden, completely overwhelming fatigue that just doesn't make any sense. Or getting short of breath without any chest pain at all. Nausea, feeling dizzy, breaking into a cold sweat. And that pain, it might not even be in the chest. It could be in your back, your neck, your jaw, or even feel like really bad indigestion. The key takeaway is these signs have to be taken just as seriously as crushing chest pain. Okay, so you see the signs, whether they're classic or one of the overlooked ones. What do? The next few moments are absolutely critical. So let's walk through the exact steps, nice and clear. This is your action plan. This is the single most important thing you can possibly do. I cannot stress this enough. Don't wait. Don't worry about being embarrassed if it's a false alarm. Every single minute that blood flow is blocked, more of the heart muscle is damaged forever. You need to call for help right away. And this next point is absolutely vital. You might think it's faster to just jump in the car and go. But an ambulance isn't just a taxi to the hospital. The paramedics inside can start life-saving treatment the second they get to you. They literally bring the emergency room to your doorstep. So, while you're waiting for that ambulance, here's what you do. First, have the person sit down and rest. You want to reduce any strain on the heart. Second, if you have aspirin and you know for sure they're not allergic, have them chew one 300 milligram tablet. It helps thin the blood. Third, if the person has angina and has been prescribed a GTN spray, they should use it as directed. And finally, just stay with them. Keep them as calm as possible until help arrives. All right, so we've got the emergency plan down. But now let's shift gears and talk about prevention. Because honestly, the best way to survive a heart attack is to do everything you can to avoid having one in the first place. And there is so much you can do to take control. So these are the big ones. These are the main things that contribute to that dangerous plaque buildup in our arteries. Now, some of these, like your family history, you just can't change. But look at that list. So many of them are directly tied to our lifestyle and choices.
And here's the good news. For pretty much every risk factor on that last slide, there is a powerful action you can take to fight back. And look, these steps might seem basic, but they are incredibly effective. Managing your blood pressure and cholesterol, eating well, moving your body, and of course, quitting smoking, these are the absolute pillars of keeping your heart healthy for the long haul.
So there you have it. You know what a heart attack can really look like, and you have a clear plan for what to do. So the real question now isn't just what you'll do with this knowledge for yourself, but who you'll share it with. Talking about these signs with your family, your friends, your loved ones, that's more than just a conversation. It's an act of care that could, quite literally, save a life.